Among veterinarians, self-promotion is kind of a dirty word. And I feel like it's something that we need to become better at so that we can advocate for ourselves and for the animals that we love. You are amazing at self-promotion, and I mean that in the highest respect. What kind of words of advice could you give to young veterinarians on how to get better at self-promotion in a good way?
So you're correct. Self-promotion has been considered sort of a dirty word in veterinary medicine, which makes sense when you remember that so many of the people who are drawn to veterinary medicine are introverts at heart. But self-promotion in a positive way is a learned skill set, just like learning surgery, just like learning dentistry, just like learning internal medicine. It's a skill set, and there are ways for us to learn those things. There are coaches available for us to emulate. There are self-training programs. There are continuing education programs. I think that at the heart of it, it really means embracing our moral responsibility to speak on behalf of beings who cannot speak for themselves. And the minute we understand that advocacy is an active and not a passive process, the self-promotion piece almost takes care of itself.
How did you get so good at it?
Lots and lots of practice, just like surgery, dentistry, and internal medicine. One of the tools that was most useful to me was not trying to change my approach to all things all at once. So it's like that old adage, how do you eat an elephant? You eat it one bite at a time. So I chose very specific areas I wanted to excel, and I actually did one of the old reliable techniques of practicing in the mirror and looking at my body language, looking at my facial expressions. It was one of the hardest things I've ever done. But it prepared me for some of the media training that I've done, where I actually had to be subjected to being taped and actually having to review those tapes with someone else in the room, which was excruciating. But again, it was a way for me to look to the larger goal. And the larger goal was, how can I do the best job for my patient and for my client every single day in the exam room?